Good afternoon. There's some energy in here. Let's try it one more time. Good afternoon.
Good afternoon.
All right. I am your Assemblymember, Assemblymember Dr. Lachey Sharp Collins. Thank you guys so much for attending my very first town hall. So you guys should be applauding yourselves. And I am truly actually happy to be having this town hall because this is the time for us to have the conversation. The town hall, I like to call it Affordability Town Hall. And the reason being is because, as you know, the budget just came out, right? And I felt that it was imperative that we do everything we can to have a conversation while it's fresh. And as a result of that, I'll go over the districts, but the purpose of this town hall is not only for me to provide an update to you in regards to the work that we are doing as far as our legislative package, but highlighting the information in the package that is addressing affordability, give you the good, the bad, the ugly in regards to the budget, but then I need to hear from you all in regards to what affordability looks like to you and how the state can address the affordability, but also what questions and or concerns do you have? If there's projects that we still need to fund, if there's some other programs and services that you guys don't want to see cut, I need to hear from you. All right, and so this is the purpose of me having that and giving us the opportunity collectively to get everything resolved and make sure that San Diego, La Mesa, Lemon Grove, parts of El Cajon, parts of Spring Valley, City Heights, and everywhere else is being heard in Sacramento. So as you can see, these are the areas that I currently cover: Southeast San Diego, El Cajon, La Mesa, Lemon Grove, Bonita, La Presa, and also Spring Valley. And like I said, City Heights as well. These are the areas that are currently being covered. But in order for me to address the actual conversations based on what some of you guys would bring up, it's important that I highlight the different committees that I serve on. As a new member, I can tell you, it's a lot. It's a lot. So I have, 6 or 7 here. I serve on aging and the long-term care. I asked for that, and there's a reason behind that. When you think about the 79th district, we have a huge senior population. So I wanted to make sure that we are elevating our seniors' voices, as they are actually the group that's being hit the hardest when it comes to the affordability conversation. Okay, so they are one of the groups that's being hit the hardest. Budget Sub 2, I serve on that committee, which is to address human services. And because I'm on Budget Sub 2, that means I'm on the overall budget as well. So I also serve on health, higher education, military and veterans affairs, and public safety. In addition to these ones as well, I'm the assistant majority leader of policy and research. That means I have a whole other team besides the team that's here. And with that particular department, we are able to do policy briefings and provide updates to our Democratic caucus in regards to really to aid in conversations on guiding the directions on where we should be going policy-wise. So by us giving them some briefings, we get to make sure that they're aware you may not need to legislate this. This is the impact that's happening here, and giving them a more of a broader perspective versus just having a narrow mind. You know, some political folks have a narrow mind, a one-track mind. But by having a policy and research team, we can truly help them be able to move forward. I also now serve as the regional coordinator for NCSL, so the National Council, what is it again? I can't get all of it off. Thank you, the National Conference of State Legislatures. And I serve on another committee, and also, 7 other select committees now? Now 8 select committees? Okay, I missed one. So add all that up. So about 17 committees or so. I'm short. I don't have a lot going on right now, but I have to stretch my energy a little bit more, right? So pretty much somewhere roughly around 17 committees that I currently serve on. My bill package. I know this is super small, and I'll make sure that you guys can get it. My bill package is not my bill package. My bill package is our package. I call the package the Working for Families package. There's 21 bills, and I can tell you out of 21, 17 are in appropriations. I've been working my butt off. So 17 are currently sitting over in appropriations. And so I want you to know the reason why I say this is our package is because my priorities are rooted and guided by equity and also affordability. And decisions that have been made in regards to this package, it has been based upon the outreach that I've received from the constituents residing within the 79th district. I truly believe that the legislation that we all push should be legislation that is responsive to the needs of those that I am speaking of and also standing up for. My legislative priorities have evolved because initially it was, okay, let's look at these things and look at that. And my chief of staff can tell you that I had to sleep on a couple of things and said this package doesn't say enough. And so woke up and scrapped some things, and then we changed some things, and now we're able to move forward. But this package itself is doing everything from safeguarding diversity initiative, uplifting K-12 education, increasing access to social safety network programs, but also making sure that our government is going to work best for everyone who lives here within the state of California. So there's a host of bills. They just passed that out, and like I said, it's too small for you to see, but there's quite a few of them that do reflect some of the district concerns, and a couple of them actually came straight from the district as well. So within that package, I want to highlight 4 of them that is really helping to address some key affordability conversations. These 4 bills from what you can see here, but if not, let me call them out to you so you can catch them on your flyer. Assembly Bill 987, that one's dealing with some toll fees. Assembly Bill 1211 is CalFresh. Assembly Bill 766 is DEIA. And Assembly Bill 1324, which is for CalWorks. All of these bills directly impact everyday lives. And when I say everyday lives, I'm not just talking about, those that are in different classes, but I'm talking about really your everyday working families, especially things that when it comes down to us looking at our budget constraints, these are some bills that can help us along that line when I get to the good, the bad, and the ugly pertaining to the budget. These bills mean supporting equity, stability, and long-term investments within our communities. And one of them that I would like to highlight first, I'm just going to hold my paper, would be Assembly Bill 766. So we all know what's going on within the White House, right? Hot mess. So we know what's going on. One of the biggest push that has come down is removing diversity, equity, and inclusion programs and services. But I always have to make sure that we add the A, which is access. So DEIA, this bill is AB 766. This is one of the Legislative Black Caucus top priority bills. And when you talk about affordability, it's not just about lowering costs, but it's also about ensuring access, fairness, and opportunities to our overall community and making sure that they have public resources that are available. If you remove DEIA, then you're taking away the access that all of our communities truly need. And so this bill itself is one, as it says on here, is basically going to require different departments to undertake a racial equity analysis. So before you approve any budget or any type of plan, we're asking you to be sure to take a racial equity analysis and make sure that we are covering all of our bases. Now, our goal is to enshrine DEIA positions across the state. And so I want you all to know at this particular time, and any time, we have not violated Prop 209. All the work that we've done as a state and what our institutions have done as well, meaning the universities and K-12, we have not done anything to go against Prop 209. So our goal is to make sure everyone knows that DEIA, it is important. When you look around this room is DEIA. And I will not be able to be here and to be your voice if you were not a part of the inclusion and the diversity and the access conversation. So it's important that we continue to elevate these ones. And with this bill, it's imperative that I remind people that everyone deserves a seat at the table. And that's what 766 does. The best way to remember this is that old tune, get your kicks on Route 66. So that's how I remember 766. Get your kicks on 766. The next bill is dealing with unreasonable toll fees. How many of you actually have had your car towed? Okay. This is going to make sure that as we continue to move forward, that we address storage fees, also the overall holiday hours, the unreasonable charges during emergencies, and also when it comes to natural disasters, but also people being charged full-day storage. And AB 987 also deals with affordability because no more charging. We're trying to get people not to charge us full days for when their car is being impounded. So when you think about it, if you're at work, your car is being impounded, you have to take off work to get there, right? To get to that vehicle, to be able to get that car out. However, not everybody has the opportunity to get off work. But if you are given the chance, let's say within a 4-hour period to get there, to get your car, you won't have to pay, my goal is that you won't have to pay a $300 fee. It will at least be cut in half. What I originally wanted was for you not to pay a fee within that actual first day or even within the first 12 hours. But of course, with conversations and also the negotiations, we had to kind of find some type of middle ground. But where we landed on is a starting point. So that means that we can still come back and make changes. And so I've had the opportunity to speak with a number of constituents, including my own child as well, and based on my experiences, but others as well who has come to me in the offices and saying, hey, this is a hot mess, especially when we had floods and during the fires, people's cars are being towed away. And for some people, that was their actual home. So you're taking away their home. And so our goal is to make sure that we can have reasonable toll fees and make sure that we don't have any more holiday price gouging taking place, because they do charge holiday fees when your vehicle was towed on a holiday. So my goal is to have extra protections when we've been able to deal with emergencies and natural disasters and make sure that we're not taking away people's families' homes, and that we're making sure that in this current climate, when we talk about affordability, we have to start tackling at least another area that has never been tackled before. People have tried, but they haven't gotten as far as I've been able to thus far, technically. So we've been able to settle on some things, but know that there is a bill coming to make sure that if our cars are being towed, we're not being charged these outlandish fees, and making sure that we're not having extra holiday charges and things are not happening during emergency times, but also looking at the full day storage. So you should be able to get your car out within the first 2 or 3 hours without having to pay this huge lump sum. Okay. We also have Assembly Bill 1211, CalFresh. So I want to share some shocking numbers. It's hard for you to see up here, but I'll read it off for you. So right now, there's 1 in 5 families in California, and even worse, more than 1 in 4 families with kids, they are struggling to put food on their table. Over 5 million of our neighbors across this state depends on CalFresh. Over 5 million. We're talking about $1 billion every month in food assistance. But here's the thing. I know it's hard to see here, but the benefits itself for CalFresh, the actual amount itself, is only $6.20 a day per person. Can you imagine trying to live and feed yourself off of $6.20 a day? Oh, thank you. Thank you. So my goal with this bill is to, one, in light of federal cuts, make sure that the state continues to fund CalFresh at its current rate. They want to slash that down to $3.20. $3.20 per person. I'm asking the state to keep it at where it is. And not only keep it at where it is, but let's go back down to look at the eligibility requirements so that way we can increase eligibility. I've always talked about rebuilding the middle class. And reminding people that even though some people do make 6 figures or even up in the 70,000, 80,000 and so forth, a lot of people are still living paycheck to paycheck right now. And so I'm asking them to do a feasibility study to see can we increase the eligibility here, but let's also go back and look at the eligibility requirements and see how we can get more people qualified for CalFresh. Let's see. Oh, I'm still going on. To me, CalFresh is a common sense piece of legislation. And as we continue to move forward and we talk about CalFresh, we know that when we look at the budget right now, this particular area is in crisis. I'm just going to be honest with you. That's going to be a part of the good, bad, the ugly conversation. And so serving on Budget Sub 2, it is our duty to continue to see how we can actually protect this. And so I've been appointed as co-chair for the select committee dealing with CalFresh for the state. And so we will have some additional hearings to hear from you all as well in regards to how we can make sure that that every family can have food on their table and not really have to give up their entire paycheck to be able to do that. So we will continue to have hard-fought conversations about this, but also addressing our food banks as well. They are in a crisis also with the food banks budgets being cut. And so we need to have a deeper dive conversation as it pertains to our food banks, making sure that our seniors are even eligible, meaning they are eligible, but they're not applying. So how do we get them equal access to the information so that way they can apply for CalFresh? Not only is it dealing with our seniors and so forth, but it really, comes down to making sure even our school programs, if you haven't heard, there is I guess you can say, I don't want to say, put it this way, it is a cut. There's a cut to our school program, our food programs. And there was a 6th grader who came to the coffee chat last Saturday, and she spoke with me inside the coffee chat and said, "Ma'am, I am super nervous. I'm nervous that I'm going to have to start paying for my food, and my family cannot afford to pay for the food." That was a gut, that was a shot to the gut, to be honest with you, for a 6th grader. And so I'm telling her, please do not worry. We're going to do everything we can to make sure that you're not paying for food, because you should not have to pay for food. This is what the families rely on to make sure the kids can get to school and learn. But also that's helping the families as well, and they give them backpacks and so forth. But it was hard for me to tell her, please don't worry, when I'm not inside her shoes. But my goal is to make sure that as we push AB 1211, that we can make sure that families such as hers and others are able to live a quality of life by having food on the table. This program is truly a lifeline for over 659,000 California children, primarily in households that are led by the Latinx community and also the Black communities as well. And so they face the most historical barriers when it comes down to being able to access food, and our goal is to rectify that and make sure that they don't have to continue to struggle to access food. When we're looking at CalWorks, same thing. AB 1324 is a Progressive Caucus priority bill, and this bill would actually modernize CalWorks to better serve California working families. Similar to what I mentioned as it pertains to CalFresh, this is once again a lifeline to a little over 659,000 people. And so with this particular bill, what we're doing is looking at removing the 100-hour clause. How many of you guys ever had CalWorks? Anyone ever heard of CalWorks? Yes? Yes?
Can you summarize it real quickly?
As quickly as possible. So right now, even with CalWorks, they have a 100-hour rule. So families cannot work more than 100 hours in order to receive the benefit for what they're giving them. So they're giving them an actual allowance to ensure that they're not living in poverty. However, the way it's structured is kind of keeping them in poverty, the way that it's currently structured. So if you are a hairstylist and you're working, but you can't work over 100 hours a week at all.
A week or a month?
I'm sorry, a month. So you have 25 hours, if so, a week. Can you imagine having to cut down your actual clientele to only take maybe two people or 3 people? It takes a lot of time to do hair, a lot of time. You're in there for at least 2 or 3 hours. So in doing that, they can only take so many people a week because they cannot work more than 100 hours a month. So with this bill, my goal is to eliminate that particular barrier, but also make sure that these workers who are working hard have the ability to even go on strike and still get paid. Right now, currently, if you are going on strike, you can be dropped from this program. And we want to make sure that people are not being dropped from this particular program. And also the program itself, we want to make sure that they are giving quality job training for actual career jobs. Right now, there are some jobs that are being provided, but our goal is to make sure that it's going to be jobs that are going to lift you out of poverty. So we want to make sure that we're also doing that as well. But this bill will cover a number of different aspects as we continue to move forward. I've chosen this bill because I felt that it's important for us to plan for tomorrow and not just talk about issues that are of yesterday. So when we're talking about affordability, you really don't have a lot of affordability if you can't work over 100 hours a month. Removing that clause would allow you to do that. Let's get to this part, and then I can get to having some deeper conversations with you. The budget overview. Whew. That's all I can say to that. Is the budget. If you've had a chance to listen to the governor's conversation and talk about the budget, some people may see or feel that the budget conversation was kind of okay, great, I think the budget's going to be good. No, not at all. Not at all. So there is a phase in politics that says, well, a phrase that says that if it's not funded, then it's not policy. So the budget is arguably the most important work that we actually do. Just this past week, the governor issued out his May revise. The May revise is proposing a $322.2 billion budget, but the proposal from the governor has acknowledged that there will be a $12 billion deficit. That deficit is largely as a result of federal tariffs and also the slowing U.S. economy. Originally, the projection was somewhere close to $20 billion. So at least now we know that it's around 12. But also the budget does not account for potential cuts from the federal government. And this is why I'm saying the budget's not looking too good. So with the $12 billion deficit here, and we still don't know what's going to happen with the federal government, our goal is to come up with plan A, B, and C, because we won't know for sure what's going to happen when the federal government's budget comes out. So what do we do within a budget? How about we get to some good stuff? The budget itself, so it proposes prison closures that's leading up to $150 million in ongoing savings. And I do have a bill, well, it's up for two, AB 785, that if it's going to be signed, that would result in this $150 million coming back to our communities in programs by sending it to programs that are known to reduce the incarceration, such as a gang violence prevention, school health, and trauma-informed mental health support. So when people keep saying that we don't have money, we do have money. And this money is not going to come from the general fund. It's going to come from money that's already being generated. So we can take that money and put that back into different programs and services that we currently need, especially in light of the implementation of Prop 36 and the promise that was made. Some of this money could be utilized once again to support the mental health support services that we currently need. It will also extend the cap and trade program by 15 years, which will result in a $3 billion a year for the utility credits to help with utility and cost of affordability. So that is some good that's coming out of it.
So where does that $3 billion go to? Does it go to reduce the utility costs?
So part of that, yes, to help reduce the utility costs, amongst so many other things as well. So we can take that money and apply it to some other areas as well without having to really go back into the general fund. So we have that. Some of the bad. So nearly 50% proposed decrease in emergency child care. That's pretty bad. We have a lot of working families, right? And so with the cut of child care right now, facing 50%, that's going to really cost some of us as parents to decide whether I go to work or I stay home. Right now, when you think about how much it costs, the price of gas and everything else, some of us, we just can't afford to stay home. So it's definitely going to cause us to think a little bit more in regards to how we're going to move forward and make sure that we can help families with childcare, but also make sure that we can serve our foster children as well. The universities, so our UCs and our CSUs, they will face a proposed 3% budget cut. Originally, that budget cut was about 8%, and then we were projecting it to be higher than 8%. And now, well, I'm happy that it's 3%, but that's still a lot for each individual campus. Yes?
That one in particular, I disagree with because I've looked into this and they have many of their professors that are on full salary for only teaching 1 or 2 classes a week. Mm-hmm. So I think their budget is way out in the left field. It needs to be completely reallocated. Okay. So I'm in full favor of cutting as much as you want from the universities because they are absolutely misusing their funding.
Okay, we're going to take a note of that. Staff is taking notes somewhere around here. They're back there in the back. So I want you guys to take a note of that. Okay. Click. Let's get to some ugly. We've all been out marching and letting people know hands off of our Medicaid, hands off of our Medi-Cal. Well, there will be cuts to Medi-Cal. There will be significant cuts to Medi-Cal that will 100% affect all of the state of California. 100%. Medi-Cal covers nearly one third of Californians, and we would have been even more. It would have been even more, but note that there is a newly announced freeze that's going to be taking place that the governor has mentioned. This freeze will limit the ability for many Californians to get insurance coverage, which will threaten public health insurance, but also it will threaten the wait times when it comes down to your appointments and or emergency visits. It's definitely going to threaten that as well. The May revised proposal for the freeze enrollment also introduces a fee of families to pay $100 a month. $100 a month for Medi-Cal. If you think about the $100 a month premium and how many families are on Medi-Cal, we're on Medi-Cal for a reason, right? So you're asking us to dive into our pockets to pay $100 a month when we know that a lot of people who are on Medi-Cal cannot afford to pay for that. All right?
Plus the copay. Plus the copay.
Plus the copay. So this is something that is projected to happen, that's being proposed by our governor. Yes.
Is that $100 a person?
Is it going to be? Yes, it is $100 per person.
So I have a family of 5, it's $500 a month.
$500 a month. $500 a month. Now let me also put something else out there for you. Beyond that, they are now talking about putting back the asset test. And that will impact a lot of our communities. That asset test is basically, so if you are a homeowner, that is considered your asset. So you may not even be eligible to apply for Medi-Cal anymore if you go through that asset test. We are in a crisis. We really are in a crisis. So we're looking at thousands, hundreds of thousands of people potentially losing medical coverage because a premium that will be placed upon you based on, yes, each individual person within the family.
Is that for new enrollees or if you're already on it?
If you're already on it, they actually put a freeze, so there's no one else can enroll right now.
Okay, but if you're already on Medi-Cal,
Yes.
do you have to pay $100 a month?
If this is implemented, yes, things will change. Things will change. Let me see if my chief, did you want to add anything to this, chief?
I mean, it's for people on fiscal coverage, so there may be people with lesser medical plans that maybe wouldn't, we don't have the details yet, because as she mentioned, it's proposed. That's why we want to have this discussion to get this feedback, because back when, our understanding is that for people with full Medi-Cal, it would be $100.
Per person.
Full Medi-Cal, so what if you're like Medicare, Medi-Cal?
That's something that I can ask about while we're there. In the end, I don't think that is right, period,
Yeah.
to make us pay. So,
Question.
yes.
What if the people, like my mother's on Medicare, does that be the same issue with Medicare?
So Medicaid and Medi-Cal, they are the same.
No, he said Medicare.
He said
Medicare, I can find out for you.
No, hold on, yes.
Yeah, I can definitely find out.
Different rules.
Yeah,
Making changes, but in a different,
totally different rules.
Yeah.
But we have no idea what it's going to be.
yeah.
So I can definitely find out for you. Yes,
Thank you for everything that you're doing. Thank you.
you're welcome.
That you're at least working and trying and let us, give us the knowledge of what we need to know. I presently pay $180, $85 on my Medicare. Will that be added?
You paying it monthly as a premium? I can find out if this would be on top of what you're already paying.
Need to know. Thank you.
I can definitely find that out. Okay? So can you make sure that those who have direct questions, that we get their contacts so I can respond to them individually? Definitely appreciate that. We still got some ugly parts. Cuts to women's health. There are more than $500 million in proposed cuts to Planned Parenthood and others providing women's health and family planning services. When health care is more difficult to access, we all lose in the increase of wait times, public health declines, and also the increased costs. So we're trying to do our best to push back in regards to the health care cuts, but the focus will be put on the budget committee within itself in regards to how we address this. So this is fostering my overall budget conversation as we continue to move forward. This is going to impact a lot of people as it pertains to healthcare. I need people to know and understand that not everyone goes to Planned Parenthood, goes there for what the typical conversation is about abortions. It's actual full healthcare that's taking place for everyone on all spectrums. And so to have a huge cut to them, that will eliminate, I think right now it's about 127, I I think, clinics across the state. If this budget goes through the way that it's proposed to, on top of federal cuts, which is they have already proposed to cut as far as federally, they would have to close anywhere between 40 to 50 facilities. So, but it's not just them. So you're talking about our local health clinics as well. They're being impacted also. And so we've already put in a budget ask to, of course, continue to fund them and backfill them throughout for the rest of this year, so that way services can still be provided. But if we continue to move forward in the direction that we have been and actually go with the budgeter's recommendations, I can tell you that we will be hit hard in regards to adequate health care and for family planning services. So that's some of the ugly side of it. What I can say to you is the governor's budget proposal is just that. It is a proposal. It is a recommendation by the governor. The final decision, meaning what's going to be pushed forward, comes from the Assembly and the Senate. So even though he's proposing all these different things, it comes back on us as committee members from that budget, those who served on the sub-twos as well, bringing back the information and going through the recommendations that the governor has put out there and make our final decisions. This is why you're here. So I can know what to bring to the table as being a member of that budget committee and making sure that they know this is what the 79th district would like to see. So there's other ways for you guys to get involved. Of course, you guys can go to the website. You can write position letters or even ask my office for different types of samples of our position letters to send to the committee, to send to the governors. You can contact my legislative director in Sacramento, also my district director and my team that's here. So that way we can continue on having the actual conversation. My district office itself, they are great at handling caseworks, whether it's from EDD or other concerns for what you have in regards to state programs. There's information on that back table that you can take with you in regards to programs and services. But also my Sacramento staff is great as well, as they handle the legislative package and any bill updates and deadlines and so forth. We have constituent services. So once again, utilize the constituent services as you guys will continue to see things coming down from the federal government that the state has to now rectify. We are already prepared to sue for various types of things that Trump is pushing forth. So we're already prepared for that. But I want you to know that me being your representative, I'm all in for you. When I ran and got into this seat, I've always said that I'm not here for me, I'm here for we. And so I want to continue our conversation. My package is our package. And if there's something that you see that you want to add to this, or even want to come up and provide testimony, reach out, let me know, and we can move forward. Can you guys collect the cards as well? I think there's some cards, some more question cards. But now what I want to do is turn this over to you. So I am going to open it up to you guys to be able to ask questions, because once again, I need to hear from you all. And does anyone would like to give me my first question? Yes.
Sure. I'm just going to ask, would you please advocate for Phase 2 construction funding for the 125-94 interchange? Thanks to the efforts of former Assemblymember Weber, current Senator Weber Pearson, Senator Padilla, and Senator Jones, we have full funding for Phase 1 and engineering and environmental docs for Phase 2. We need construction funding for Phase 2 of the 125-94 interchange. And the other question is, listening to your pitch, in your conversations with GOP members, why do they oppose government assistance to the working poor and middle class?
When I read that, I was shocked myself. So I don't know why they are opposing. I really don't. Well, I get that part. Part of it is dealing with, you know how we are pushing people to the safety net programs? Well, they are taking away that net. They're cutting it. So the tax cuts itself is part of the reason why, but I still don't understand it, in my personal opinion. We still should do everything we can to be able to provide. But the reason has to do mostly with the tax cuts.
Thank you.
Can I keep your question? I want to make sure I have your question.
125-94, it's Phase 2. You're not going to
That's okay.
need to do that until 2028, but I want to put it on your radar screen, please.
Okay. I'm going to take that one. You tell me who's next. Yes.
Is there any kind of a backup that California has if their budget passes in government for like HUD housing, Section 8 people?
Is there a backup for it?
Yeah.
So, do you want to chime in with me? Come on.
Frankly, no. The size of the federal government's contribution to our housing and homelessness efforts, California's budget simply couldn't sustain. That being said, the Assembly members participating with other legislatures this year to advance a housing bond. Discussions center around about $10 billion. That's a drop in the bucket of the money that we receive from the federal government. Should they cut some of the programs that they're talking about, Section 8 vouchers end overnight, and potentially thousands of people are out of homes. That's how dire the situation is. So there's, yes, yeah.
So I'm homeless.
Yes.
Not on my watch. Not on my watch.
Speak up just a little bit for our friends.
Sorry.
Yes.
One second, okay, 1 second.
Hold on.
Since we have no audio, when you speak, please project as loudly as you can, so everyone can hear. Thank you.
I also want to highlight that we have 211 here in the room, and I would like to give you the opportunity also to add in and chime in as well in regards to housing and questions and or concerns and the services that 201 provides. They have a table over here. Would you like to? Come on.
Sure,
Yes,
yes.
please.
For those of you who are not, thank you so much.
You're welcome.
For those of you who are not aware, 211 San Diego is a free community resource. We are a nonprofit organization. There are 211s across the country, but locally we are 211 San Diego. We're open 24 hours a day. If you dial 211 at any point in time,
all
you will
budget
be
questions,
live
assist me please with the
We'll be
responses.
able to listen to what your situation is and search for a resource or more resources that may be able to attend to that situation to the best extent possible, depending on what resources are available and listed in our database, which we manage. We answer calls in any language. So I think that's the gist, but I'm here to I can address any other questions about some information that may be available in the community as well as we go through today. Thank you so much.
Thank you. I had the chance to visit 211 the other day as well, and during our conversations, I specifically asked for a representative to come because they have a lot of information that a number of people are not aware of, programs and services that they currently provide. So if you are not familiar, please grab some of the information that's there. They did a lot more than what I thought. And so I wanted to make sure that I share what I've learned with everyone here. Yes.
So I want to ask a question about education, but I did want
Sure.
to just say we're very grateful that you're having these sessions and for your advocacy. I work with a lot of national progressive organizations, and the cuts from DC are very real, and we know that you're going to have to make some very hard decisions, so we appreciate your advocacy. I am very concerned about AB 84. It's a school that's going to cut funding to charter schools.
Charter schools.
As a mama of 4 kids, 2 went through traditional district schools, 2 in charter schools, and every legislative session we've had to fight for our kids in public charter schools. So I'm really hopeful that you will oppose 84. I know there's a lot of pressure on Democrats to support it, but there is another bill in the Senate, SB 414, that would take care of the accountability work, and so would love to hear what you have to say about public school kids, period, just great. They all deserve to go to a great school.
Yes.
What is AB 84, please?
It would take a 30% cut to most charter public schools, and it also adds a lot of unfunded mandates on
Yes.
schools.
So you've actually took the words out of my mouth. I'm all for quality education. So wherever school people are going to, I want them to make sure that their child is able to receive the best education possible. I have not had a chance to officially dive into AB 84. That bill will be coming to the floor. And so as it's coming to the floor, we will continue to do our analysis. But my staff has had different conversations with different groups that have come in to talk about it. And our response is, data is key. So if folks can provide the data to back up the conversation, then I can be able to bring that data into those rooms when decisions are being made in regards to that. So staff has been talking about it, but a deep dive with me, that's yet to come because we need to know when it's going to be on file, and then we'll go from there. So it is on my radar.
Thank you.
Yes. Yes.
Dr. Ryan, thank you for having this town hall meeting. I work for Cajon Valley School District.
Cajon Valley?
Cajon Valley
Okay.
School District, specifically the after-school programs and the ELOP, which are expanded learning opportunities programming. And this is happening particularly in my school district, but also I am aware of other school districts within the county that they have run out of pandemic and COVID funds, which allowed for before and after care and after school programming of duplicated students, which are homeless, foster, English learners, and low economic families to have access to these programs because at the time they were considered essential workers. Since we have had run out of those funds officially, we were trying to expand them as long as we could, but now we have outsourced that fund. And I was wondering if there's any budget allocation or reallocations since these school districts are seeing cuts and now we have less places to source from now that we're seeing cuts, and also we are running out of those funds that were originally set out to help these families.
Right.
And these families are people that we see that don't have transportation, and they really rely on all these resources. So we first give them to them, and then we take them back. So I just wanted to see if there's anything to continue that those resources that we told them that you're so essential to us, you deserve this, and now we're saying sorry, no longer.
Right. So Prop 9, the 98 funds for the education part of it is looking better than what people projected. So that part is looking pretty good. But when it comes down to the actual budget itself, the governor has been really invested in our community schools. And I'm not sure if Cajon Valley is a part of the community schools. Are they a part of community schools?
I'm not gonna know where.
Okay. Because I know that they're a part of the CEI, the Community Engagement Initiative. But if they're a part of community schools, that is still being funded. So there's money there. And community schools is to address full wraparound services. That is including your after-school care and et cetera. So I would recommend that you consider looking into if Cajon Valley is a part of the community schools work and see what that budget is, and talk with the leadership, superintendents and so forth, and identify how they plan on utilizing some of that money to make sure that the full wraparound support services is going to still be able to obviously be there for the school districts. It may look different because it's a certain pocket of money, but he is committed to community schools. So there's money that's for community schools. So let's find that out and make sure that they're bringing that down because it's wraparound services. Yes.
Thank you again for being here. I have two questions. The first is, are you aware that the California Department of Social Services is preventing counties from seeking federal funding for prevention services, which actually support 211's work in the community? And this is because they won't allow counties to procure their own billing system to track expenses. And so our county is leaving, several $1 million on the table. And it's a policy decision, it's not a legislative decision.
Right.
So
Right.
happy to help you with that because it's really frustrating in this community. The second question is, are you or will you support the California Alliance's ask for $42 million to support foster care in the state of California? This will backfill foster family agencies for the lack of state funding that hasn't happened over the last 20 years that I've been involved in this.
So I have been supportive of this whole time, but the reality of it is, even though I am supportive, knowing that with the $12 billion deficit here and then the federal cuts there, everything regardless is still going to be on the line. And so we're trying to figure out creative ways as well with our larger ask to see if we can still get some of the things that we want, but of course lower the actual cost of that ask. So we're trying to be creative and think outside the box on how we can still try to get this implemented and actually funded. So, but no, everything is on the line. I have four budget asks? Three big budget asks that are in, and we have to finagle them to make sure that we can still get some of what we want in the hopes of getting it funded. But I can tell you right now, the reality is a lot of our things are being placed on hold unless it's going to address the here and now and the affordability. So.
As an example of
then hearing him.
to what the member's talking about, I'll put more color to it. Her largest budget ask this year was Her largest budget ask this year was $250 million. We got an emergency call yesterday from the sponsors of this, county welfare directors, actually. This was related to CalWorks programs, saying that because of how bad the budget conditions are, can we please shrink our budget ask by 80% just to get something? And this money would backfill work that counties have already done on CalWorks that they can't afford, just to keep us at 2023 levels of CalWorks participation. We're 2 years further on, and we know the economy is getting worse. We know many more people are going to be asking for these services, and just to get something this year, her budget ask is 80% less than it was a month ago.
Yes, thank you. Yes.
Hi, thank you again for coming here and speaking to us. Someone might have asked a question before, I couldn't hear. Your legislative package for 2025 doesn't address, just what I can see, housing. And you might have answered that before, but I didn't hear the answer. What is your role in this issue? And because HUD is going to be cut for Trump, both federal and state, what is your role in this? And kind of a loaded question, but
No, it's okay. So we are supporting the housing bond. So there is a bond that's being led by Assemblymember Wicks. And so as she continued to do this process, I've actually signed on to the bond work as well. So that way we can do everything we need to do to fund housing and make sure that we have the money there for HUD and everything else. And the other thing as well is within my conversations of talking about housing, I've been very, very strong on we need to continue not only to talk about affordable housing, but we need to define what affordable housing really is, but also make sure that we are still building single family homes to promote generational wealth.
yeah.
So that is a part of the conversation through Wicks and a host of others as well. But I am playing a pivotal role in making sure that as we continue to talk about we have to build housing, well, we can't forget about generational wealth and people wanting to own homes and et cetera, and not always put all the high rises where people have purchased their homes to obviously grow a family and et cetera, and then all of a sudden the high rise is coming up. There's no parking there, there's no this and no that. So really diving into the whole density conversation as well. All of this is going to be encompassed in the bonds conversation.
I mean, like this place over here.
That is one example,
Yeah.
but there's other ones. Yeah, and then your area, right? You have units that are coming up there with no parking and 2 ways in. No, yeah, is it 1 way, 2 ways in and out, 2 ways. And you have 2 schools. So you have 2 schools, a high school and an elementary school, with 1 way in by the high school and 1 way in by the elementary school. And those are the same ways you get out. So they can't even get out of their area when school is let out. So we are seeking to address that. I'm also having conversations with our county and our city as well in regards to what's happening.
Medicare issue.
Yes.
Yeah.
Okay. Yes.
Thank you so much, Assemblymember Sean Collins. My name is TJ Harris from the Black Leadership Alliance Coalition. And my greatest concern is the great black migration out of California right now. We know that we only represent 6% of San Diego as far as black representatives. And we have got to a point where we can't afford to live in California or San Diego anymore. So I would love to see if your plan, your bill addresses the great migration out of California for black and brown residents.
So the California Legislative Black Caucus package is called the Road to Repair package for 2025. That addresses what you're asking. And so I don't have, did we bring copies of that package today? Okay. But within that is also being addressed through the Legislative Black Caucus priority bills to look into that. The other thing too is when we're talking about housing and generational wealth, I've been talking about making sure that not only are we looking at those that are on Section 8, but how do we move people out of Section 8 into some other housing so that way we can continue on the cycle. So those that are looking for housing now have the option to get into housing, but let's transition those that are on current Section 8 housing into home ownership. And so they have these programs available, but the issue becomes the lack of capacity. They don't have enough manpower to actually push the programs and services. So the voucher program that currently exists, a lot of people they're not aware that there is a program to assist you with a down payment, to assist you with even getting into a home and moving out of just moving out of the other type of housing assistance. Yes.
So the way I look at it is the way to get people out of Section 8 housing isn't to give them free money, it's to give them a job.
Correct.
Don't be pushing free money for this, free money for that, free money for everything else. Push economy.
Correct.
And people being wealthy by their own productivity.
Mm-hmm.
Make it easier. Take all the regulations that we've got on the books now about fees for this and permits for that, and just to start a home micro kitchen costs $572 for an inspection, where they claim it to be a great deal, but it really isn't. the whole conversation is all about finding more money to give people. That's not the answer. The answer is making them prosperous on their own.
Correct.
Giving them the education so they can get a good job and not necessarily college. Plumbers make a great living.
Oh, yeah. Oh, yeah. I see.
And giving them the opportunity to be wealthy without taking money from the government.
Understood.
That's
Understood.
That's the way to change the state.
And you're right, it is. That is the way. I see you guys. And so he's absolutely correct. That is the way to, for us to be able to move forward. Now, you do have some folks that are okay, they have the jobs, but they're still living in Section 8. So we need to get them out of it. So that way those who really need it can come in and utilize it. And right now, there's so many people that are actually complacent. They're just staying on. And I don't know how they're finagling things when they go up for their evaluation, but they're still making it work to where they're still utilizing
We're making it
Section
easy
8 housing.
We're making
So-
it easy to be lazy. That's the whole state of California, is making it easy for people to be lazy.
Actually, there's a lot, most of the people are working for this.
That they just haven't been able to be able to afford to do it.
Just sitting at home.
Yeah.
Now,
No, so keep in mind that when we're talking about this, we are looking at a lot of people are working families. They're not just sitting at home.
Right.
A lot of people are working families. And as I said earlier, we have a number of people that are in the 6 figures still that are paycheck to paycheck. People that are in, the 5 figures. So we look at 85,000 or more, whichever, still paycheck to paycheck. Still struggling. So this is a larger picture here that we have to address. And how do we do that? It's going to take all of us collectively to do that. So you are making a really great point that we need to continue to make sure that we are not only people that need it, people who need it the most gets it. And as I say often, the people closest to the pain should be closest to the power. So making sure that those that need it, they have it readily available to them to be able to move forward, but don't have them rely on that source, on that resource for the entire time. Do what we can to grow them and expand their ability, their job capabilities, so that way they can continue to move on and others can come on in. That's what we need to do. Yes.
One thing must be understood about this when it comes to free money. Even when civil rights was in step and was legal, when you couldn't be discriminatory against somebody. They were still
Okay, I'll say that.
There were places, there were things, bills in place, even programs that were in place to stop people. You can go to when you were being discriminated against. Didn't matter who you were. Okay, DEI is gone.
Okay,
Civil rights is gone.
I gotta pause you on that. DEI still exists. You wanna know how?
Well, but we know it exists, but it exists just like equity is evil.
Yeah, and it's not.
I mean, we know it's on paper that it looks that way, but even when it was legal, it was still discriminatory. And people worked their butts off. Okay? They don't. Nobody's asking for free money. You want to talk about people with free money? My biggest question was: is it absolute? What's your understanding of why all these savings are being taken by the federal government? Is it because they're balancing the budget, or are they really, as they've admitted so many times, setting this up to take these savings to give themselves a $4.2 trillion tax cut? Now, you want to talk about free money? Right. That's been going on for millennia.
That was good.
I'll just say one thing.
That was good.
And maybe we can move on to another question. But to the question of the tax cuts, and the Assembly member alluded to it earlier, the amount of money proposed as cuts to Medicaid and to CalFresh combined equals the amount of money exactly to the dollar proposed in tax cuts to the richest 5% of Americans, I think it is. The average amount of tax cut that those individuals would see is about $60,000 a year. This is for people making $750,000 or more. The average tax cut they would see is $60,000. That is higher than the net annual income for individuals on both Medi-Cal and CalFresh. It's a wealth transfer.
There's your free money.
Another question.
Mr. Keys?
4.2 trillion?
Well, first of all, I don't know if I.
Hold on, sorry, gentlemen. We're gonna go to
Mr. Keys?
My question, first I want to thank you for your transparency, for representing community, going out of your way to try to connect with the community. That means a lot to me, and I just want to let you know that.
Thank you.
But my question is more like a plea with the question of state help, or is there any kind of state help that could bring equity to the preservation of underserved communities' green spaces. In particular, a historic park and radio tower location in Emerald Hills is a diamond in the heart of the city, like a central park, and it just, to me, it's just, we're about to lose it to out-of-state developers. It's been private property all these years, and I feel like the city is complicit, and I'm begging the state, I'm begging you, anything you could do, eminent domain, something, help us expose this beautiful property to the city of San Diego residents. It's behind my house. I'll give you free access to it. It's one of the most beautiful spots in San Diego. Rivals Mount Soledad, Mount Helix, Point Loma, and they are just degrading the historical significance of this spot. And we need your help. Our community is in uproar over this matter. They had illegal footnotes passed, trying to, push development on this property.
Footnote 7.
Just so corrupt. I lose sleep over it.
Yeah, so I've been to city council, my staff has been to city council as well, and we wrote a letter in regards to footnote 7. And the conversation is still being had. They are aware of where I stand and how some of these developments need to also be spread out and be moved elsewhere instead of constantly packing everything into our communities. So as we continue on having the conversation, typically assembly members can do a one-time ask for a financial allocation. This year with the budget cuts, we're not going to be able to do that. However, know that the conversation is being had with our county rep, Monica Montgomery Stepp, but also with our city council member for the city of San Diego in regards to how they're going to move forward. So they know that the community is in an uproar and they know that they need to figure something else out. So Matthew is attending those meetings and still representing the office, and now even more so your voice in regards to where folks stand pertaining to this and trying to protect and preserve what currently exists. So we are a part of that conversation.
I appreciate that.
You're
The
welcome.
second question
Oh,
I had
okay. And then here, and then here.
was just to piggyback on, they were talking about the Section 8. In your opinion, like say the average person, they were saying a 14, 13, 15-year wait.
It is.
Is that beyond that now, you think?
Oh yeah, there's people.
Beyond 15 years.
Oh yeah, there's people on there for about 20 some odd years, about maybe even 25-year wait for Section 8. And there's people who need it literally right now. They're in dire need, living in their cars, but they're on a wait list that can go up to over 20 years. Yes. Yes. And this is even with seniors. It's a seniors community, all the above. They are on a list waiting for over 20 some odd years still to get into Section 8 housing. Yes.
Right, yeah, thank you, Doctor. And I appreciate other folks who just brought up the housing issue, because I think for most of us, whether we own or rent, that's probably our largest expense every month. And it has only gotten worse over the last 30, 35 years. For the reason that I think is very simple: we have a fixed resource of land, we don't use it very efficiently. And while I appreciate what you said about trying to build that generational wealth, and that certainly is to address something that the gentleman brought up, which is that there are people who were shut out of that in the past. We want to have more homes available, but I don't think that a single-minded promotion of single-family homes is a good way to do that. And I hope you don't either, and you mentioned it, maybe I misunderstood. You look around this district, we don't have land for that.
Correct.
So we need from our state government to impose on some of these local governments smart ideas about how to do townhomes, how to do mid-rises, how to put them in the right places, because we don't have the land.
Right.
And you can look at the data of this 30, 35, 40 years. We haven't been building the way we were in the 70s. We've run out of land. And for people in my generation, I don't need a yard as much as I need a place that I can afford. And hopefully it's a place like this gentleman said, where we also have green spaces. But if all we're doing is building cookie cutter houses everywhere, we don't have space for green spaces and it's not affordable. And
Correct.
Again, please, with your colleagues in the majority, continue to push this issue.
Thank you. Did you want to add anything?
Well said.
Yeah, well said.
And affordable.
Oh yeah, it has to be affordable, and that's the key, is defining, making sure that it is affordable. Having a unit comes up that's $3,000 a month is not necessarily affordable. So how do we do that? So I have always said that we can't build our way out of this crisis. However, we have been talking about looking at state property itself, because we do have our own property, so being able to build on that. There's also some legislation that Assemblymember Lee is looking at for social housing itself, for the all-encompassing of different types of the income levels. And then there's also looking at to where the universities or even some of the churches that have land as well, being able to build housing on their properties as well. So there's a much larger conversation in regards to how we can get this rectified, but we already know we need housing. It needs to be really affordable.
I suggest, like, if you own property, if you the state or the city and you own a building, you set the rate for the monthly rate. If you the owner and the rate needs to be dropped, and you apply to get into that place, but start popping those up.
Yeah.
You know, and because you can control, but when you leave it through the market rate here in San Diego is going to always be up there.
It is definitely sky high. And the additional conversations too is making sure that we are building housing around transportation. And we know when we talk about going to Spring Valley and going to the area, there's a lack of transportation and access going into that particular area. So we do need more bus routes. We do need a trolley stop that's going to come over in that way as well, and so forth. So we have to be mindful of where we're putting the housing and make sure that we're not, actually enabling people the opportunity, not giving them the chance to take the transportation to get to work, to get to their appointments, to get to whatever they need to do. And it's difficult if we're putting housing in places that's not by public transit. Yes.
So I have two questions. The first question is around the budget. So I'm with the organization called PANA, and we're located in the Mid-City area. One of the things we pay attention to is the state budget, and consistently what we know is like San Diego just doesn't get its fair share in terms of state allocations and carve-outs and line item budgets and things like that. So in this budget, the request is like when you're looking at like the housing, the Department of Housing, legal services, like specific things that impact us as both a border city and as a really high housing cost city, making sure like instead of yet another allocation going to San Francisco or LA, like really fighting for San Diego and San Diego's budget. So that's one ask. The other is both for you and I think people in this room, because housing is complicated. It's something we've been working on for
Ever.
10 years almost now.
Forever. 30, look, longer.
Exactly. One of my pet peeves though and the irks is the people in the room deciding what the housing solutions are normally landowners. And when I say landowners, I'm not talking about homeowners, I'm talking about developers, right? And they're shaping policy. And so one of the things is like, how can we, like we have a proposal and idea if folks in this room want to get organized. So that's one invitation. And the other is like, would you consider proposing state legislation to help us do what San Francisco, LA have done with like SCAMP and like, I forget the name of the agency, but BAFA in the Bay Area, they created a regional housing finance authority that would both raise revenue for housing, but also like plan housing for the next decade, 50 years, instead of all these piecemeal, right?
Isn't that in the
How do
bond?
we shape policy that helps us think about that?
Yeah.
And my proposal is like people in this room should get involved to help shape that policy because it's developers that are normally shaping policy like that.
Yeah,
So
a concept similar,
collaborate with us.
a concept similar to that is a part of the bond, the whole housing package that is being spearheaded by Assemblymember Wicks.
So this would complement that. This would be local control. So look,
Understood.
because we need the state funding. I'm not saying don't do that. We absolutely need to do that. But we also need a local funding mechanism, and we need a funding mechanism that also marries the land use, the planning and zoning, all of that together. Because if we're planning housing here, transportation here, finance here, then we all lose, developers win, right? But if we're planning for our future and really thinking about all the pieces, then I think we can get closer to a real solution.
Appreciate
To your
that.
question about San Diego specific responses, I'll say that this year the legislature, and rightfully so, has been hyper focused on Los Angeles after the fires.
Yes.
In every single one of those conversations, every single one, your assembly member has said, we had floods in San Diego a year ago and no one said anything. And everything you're doing in those resources should be available for San Diego for our floods, but for anywhere in the state, because natural disasters are going to continue to happen. What happened in LA was not an aberration. So to your point, she is fighting for the San Diego dollars. Very specific.
I'm like, I'm doing it. I'm actually scheduling the tour for them to come down, our speaker and our emergency management chair and others to come down and take a tour of the areas that have been impacted by the floods and see where we are at and how much additional support we need for the recovery. So I've definitely been telling people, you know, San Diego, we have so many elected officials that are up in Sacramento, and it's my goal to elevate our voice 100%. We all can't be silent in regards to our needs, and I was really upset about the fact that there was not enough aid that came to our district as it pertained. This district was a district that was hit hard by that flood. So that's still a big top priority, and it's still being hit hard, and it's being neglected in so many ways.
Thank you, Assemblywoman, for your time and your transparency. Someone mentioned transparency. I thank you for having these town halls with many in the country don't want to be bothered with their constituents. They just turn their backs on it and tell them, no, we're not doing this. So thank you for that. And thank you, each and every one of you, for your questions. I heard a couple of things. To the Medicare situation, I'm gonna make a comment and it's gonna tie in because I have a general question to encompass the point I'm about to make. With the Medicare, it essentially, I heard that there are planned cuts to these programs, and then on the other hand, what essentially turns out to be a tax imposed on the recipients and participants of the program.
Yes.
Okay, I think that speaks for itself. Second thing, last year we had the natural disaster over in the southeast area of town with the flooding and the infrastructure or lack thereof upkeep in that area. And I don't know how many of you may know this or not, but there's also the potential disasters, God forbid, because of the train routes that carry hazardous waste through La Mesa, through Lemon Grove, in the dead of night. They're not doing these in the daytime. They're in the dead of night, and it has potential for just catastrophe. Do you have it on your books to, I don't know, maybe redirect these train lines or have that conversation? I mean, that's because that's not happening in La Jolla.
Correct.
You're not having these freight trains full of hazardous waste go through the middle of La Jolla, but they're routed this way.
So the answer to your question, that's been on my radar for a very long time. I'm born and raised right in Southeast San Diego. And so even when I was on the other side prior to being elected, I talked about that as well, about the fact that we have these trains that are coming in 12 o'clock, 1 o'clock, 2 o'clock in the morning, and we have no idea what's on there. But when you think about the leading cause of death within San Diego and other areas, it is cardiovascular disease. But in San Diego, and primarily in our district, we have a cancer cluster. It is cancer. So we have no idea what's coming through. And so having a deeper conversation in regards to our environmental justice to make sure that we are addressing these things and figuring out what is on these trains and so forth. That has been a part of the conversation. It has been on my radar. And so I don't know how we can move forward per se without having the conversations with our county and our city in regards to this infrastructure that currently exists. But I will continue to push and further on that dialogue moving forward, because we have a cancer cluster in our district.
It triple the amount
And I
of
see.
road that's on the train, so
Mhm.
whatever they doing in the middle of the night, it's plenty going through during the day on the roads, trust me.
Mhm. Yes.
So I'll try and be brief.
Okay.
I'm Alexis Primo. I am the organizer of the San Diego chapter for Current Voices. And what we do, we communicate with parents in the community that are facing difficulties with the systems we have in place to help them. And we give them the opportunity to go do legislative visits and share their personalized opinion with elected officials, with the hope that it's not just like the numbers that organizations say they're assisting that is being reported, but it's also like these families' experiences directly that are not being, because the budget is so low, everyone can get help. So we advocate for CalWorks, immigration, childcare, and parents that are having housing difficulties. So we had the opportunity to do some legislative visits on Wednesday. We met with Akila Weber's office. We met with her ward in person, and we were also able to go to the Center for Dia's office. We visited your office, and we met with Adriana.
Ariana.
Ariana, yeah. And it was really good that parents were able to find their voice and know that they are able to advocate for themselves. The reason why we did these visits is we have a Care for Our Children pledge, and I left a copy there, and I have another copy I'll give you to review, and we're hoping that you could sign on our pledge. And our pledge is pretty much asking if you could check the boxes of CalWorks, immigration, childcare, whichever ones that you are okay to advocate for us on behalf of parents within the community while you're at the table. Thank you.
No problem. I am a parent. One of my kids is here. Hi, son. Hi, Zion. So, I am a parent.
It's difficult as parents to provide the needs for children while having to work. Like right now, there's, CalWorks is endangered.
Oh, yeah.
There's like the health of the children, and then parents are already trying so hard to survive and work, and then worry about your kids being sick, and you can't even take care of them. It is like really not fair.
Absolutely. Totally agree with you. I think we have time for one more question.
Oh,
I'm sorry.
Actually, I have a comment. I just walked in from out there. I didn't know this was happening, but I wanted to check out what's going on. I run a community outreach once a month down the street, and we reach out to the marginalized in La Mesa only. And I just want to advocate for an organization called the Home Team. I don't know if you guys are aware of the Home Team. They work out of the La Mesa Police Department right here, and they also work towards ending homelessness in the city of La Mesa. And what makes them so powerful is that they are able to connect individually with each homeless person to get them their paperwork back, which is a huge problem for a lot of them.
I want to see if folks can take a group picture.
They hook them up to services, and we have them at our community outreach every single month. They're there to help people in the community of La Mesa.
Thank you. Thank you.
I saw you had your hand up earlier and you didn't ask.
Yes.
Oh,
Right here. Yes. Yes.
Oh, hi, yes.
Did you?
I had various questions.
Uh-oh. Look, she said, let me get up.
So we're founders of a really special housing component here in San Diego. So we have about 100 beds, and we house women and children, we house single women, and we house men, all that belong to like a clinical outpatient treatment program through the county. They're either like on some sort of like, I don't know, methadone or medicated assisted treatment or some sort of substance abuse diagnosis or mental health diagnosis of some sort, or maybe someone that just can't afford to pay rent. And we've been around for 5 years. We've been trying to get in front of people like you, because I feel that people in your seats they have passion, they want to do it. Like our mayor, for example, like I think of Gloria, that's what I think of when I think of the mayor, because I've been following him for so long. But he doesn't know what the fuck he's doing.
Okay.
You know what I mean?
I got
love
you.
him, I'm a fan of his, there's pictures, I've been to breakfasts with him. I've been to his office, I bring plants, and I'm like, hey, call me. But like, nobody calls us. We've been doing it for so long, we know what we're doing, no one talks about stabilization. Everybody talks about, let's put them in housing, that doesn't work. You know what I mean? And the next thing you know, 6 months later, they're homeless again.
Right.
Because they relapse or triggered. Moms and kids, they come into our housing component, they're regulating themselves and their children. It's a lot for them, you know? They can't afford, like CalWorks is not PGE funding is what I think of when I think of CalWorks, because that's the funding that helps moms that have CalWorks.
Yeah, to pay the
that get into their own
bills.
apartments.
Yeah, to
We
pay their
work on all
bills.
those things, like behavioral health, I know behavioral health. I work for nonprofit, I work for private, I do marketing for a private company now, so it's like, we know what we want to tell y'all to make this work for us. You know what I mean? Born and raised in San Diego. I'm a child of immigrants. My parents came here from Vietnam during the war. You know what I mean? They didn't know no better. They were all registered as Republicans because as they got off the U.S.
Understood.
That's what they did. You know what I
Understood.
mean? So we didn't know until we got educated. My dad voted for Trump. I told him not to. It is what it is. But, you know, we have, like, knowledge.
Yeah.
If I could just spend a little time.
Yeah, I'm going to.
I would
I'm
love
going
to
to
do
announce
that,
it right now.
you know?
Yeah. Well, what I want to say to you, first of all, thank you.
Of course.
Thank you.
Thank you so much for being here.
Nah, you're welcome. And to add to that, so I'm hosting bi-monthly Prop 36 meetings.
Wonderful. I would love to sponsor
And
those.
so I would love to invite you to attend, and anyone else who would like to attend the Prop 36 meetings. And so my goal is to make sure that we have everyone that was from all sides in the room to have a dialogue, because no matter which side we were on, when that vote came in, it's in. And it's been implemented since December 18th. A lot of people are not aware that it's in full effect since December 18th. And the issue now becomes capacity in regards to being able to actually support the promise that was made. And there's not enough capacity programs even available or even beds available and so forth to address the high demand right now as it pertains to the Prop 36 arrest. So I'm having those conversations, keeping it on our radar, and elevating that conversation back to the Assembly to remind people, hello, people voted for this. Now we need to figure this out and make sure that we're going to do everything we can to minimize its impact. And right now it's having a huge impact to where they're asking for funding. And the promise initially with Prop 36 was it wasn't going to cost the state anything. And it promised, obviously, to reform, right, to bring people in, to get them treatment, and et cetera. That's not happening. Right now it's not happening. So you're invited to the conversation. There was no plan as far as the rollout. So they're trying to, build the plane while they're flying it? That's what they're doing right now. And so I'm making sure that we stay in the conversation. So please make sure that you get the information from my district director and know to come. It's on June 13th, actually, which is the next Prop 36 conversation. I think, do we have time for any more questions, or that was it?
I think so.
If you're interested in housing, see me. Let's meet.
But what I want to do, honestly, is thank each and every one of you for taking time out of your Saturday to come in to meet with me, to share your thoughts. My staff did take down those notes. I will share that information. Once we have the final budget, which will be by June 15th, myself and Senator Weber Pearson will be doing a joint town hall to have a deeper dive conversation, and actually as we get closer to what the federal government's budget as well, and what that's going to look like. So we've already agreed to do a joint town hall again after we do that, because she covers a much larger area, obviously, than what we covered for the 79th. But I really appreciate you guys taking the time to honestly be vulnerable, to be candid with me. Being born and raised in Southeast San Diego, just really being a part of 79th, this is my passion, this is my heart. I'm not here to move up to any other position. I'm not here for any of that. I'm here because I truly care. And I truly do want to hear from you, and I want to know how we can move forward. I can't even be in this position without you. And I tell my colleagues the same thing. Remember why you're here. So if you were here to move up, then you do what you do. But everyone else telling me, no, I am here for the people. I'm here for the community. Well, you need to really be here for the people and the community, and think about your journey and your story and how you got to where you are. So I know for me, it wasn't peaches and creams and roses. You know, there's still a journey. Everybody has something. So remember that, and make sure that when you're talking to your people, allow them to humanize the situation, humanize what's going on. Put a face to different decisions you're making before you make that decision. That's the type of conversations that I'm having, and I'm grateful that everyone's here to continue on in this dialogue and make sure that I am well informed on how I can take it back to the budget. I really appreciate it. And as we're leaving, I'm not sure if you would like to, but I would like to take a nice group photo, if you don't mind, of everyone that's here. And thank you again for being here. Appreciate it.